Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Dennis Hursh, healthcare attorney. Today's Kevin MD article is Private Practice Employment Agreements. What happens if private equity swoops in? Dennis, welcome back to the show.
Oh, thanks. It's great to be here.
All right. That issue of private equity buying a lot of independent practices is definitely in the forefront, and certainly interested in hearing your perspective from the contractual standpoint. So, what led you first to focus on the impact of private equity on physician employment agreements?
Well, it's funny. I get very mixed results talking to people. I have physicians that work for private equity and they love it. They say there's money now. When we were in private practice, we never had the money to afford the latest gizmo. And now I just say, hey, I think this would come in. And the company says, oh, yeah, we can make a lot of money with that. Certainly we'll buy that. So the capital's there. I have some physicians that say it's not that different from when I was in private practice. And the ones you hear more of, though, are the ones that say, yeah, I'm now, I'm like a factory worker. I've got an assembly line. The patients are ripping in everything. I've had people say I'm under pressure to order more labs. I mean, just everything you can imagine horrible about practicing medicine. It's like a hospital but 10 times worse sometimes. So I guess it's important to think it really isn't horrible. It's not necessarily going to be a horrible experience if private equity comes in.
Because you, like you said, hear about the universal experiences of the private equity model, right? They will buy a practice, they would cut costs so they could sell it at a higher price, right? That's how private equity makes money, right? And you hear from the physician standpoint in some cases where they're being squeezed to order more tests and see more patients, and at the end, patients suffer. But you do see cases where physicians are actually happy with the private equity model. Is that correct?
Yeah, I do. As I said, there's capital there. So if we need something, it used to be like, well, the carpet's a little shabby in the reception area. Now there's plenty of money for that. I don't know that I could justify buying this gizmo, and the private equity says, oh yeah, we can make a lot of money if we buy that, and we have the capital. So, we're going to get you that, and then we'll market that you have that. And so in some sense, in some cases, actually the physicians are very happy and they're actually better. I'd say that's, I won't say rare. The majority are not happy with private equity, but there are some.
So tell us from a physician contract standpoint, what's the most common first interaction that a physician group has with private equity?
Well, a lot of times you just get a call kind of out of the blue, but that says, "Hey, would you be interested in selling?" And I've had situations where it's actually destroyed a practice. Some of it depends on the shareholder agreement. Physicians come in and I got this great deal. If I become a partner, it's like $10 and I become an equal partner. But guess what? When you leave, you get $10. So you get these mid 50s, 60s, and sometimes older physicians. Private equity comes in and says, hey, we'd be willing to give you a couple $100,000 for your ownership in the practice. And they're looking at, if I retire in 2 years, you guys will give me $10. Private equity will give me hundreds of thousands of dollars. It may not be a hard decision for them to say, I want to do that. And I've actually represented practices that were just split down the middle. The younger physicians said, no way, no how. We love being independent. That's why I came to a private practice, and we're going to stay. And the older physicians sold out. So it literally just destroyed the practice. They cut two practices now with the younger physicians in one and the older physicians in private equity.
Is there a specific type of practice that private equity typically looks at to buy?
Yeah, although it's expanding. For a long time, it was dermatology. You saw orthopedic surgery. Some of the like kind of high dollar ones were coming in, but now I'm seeing it in, primary care and other specialties too. They're starting to just roll up lots of specialties. It's not as one-sided as it used to be. Anesthesiology too has been big for private equity.
So private equity typically contacts practice, see whether there is any interest in selling or not. Now, from the practice standpoint, what normally happens next, and what are some of the pitfalls that you've seen along that path?
Well, what normally happens next is I've had practices that just said nope. I mean I don't want to hear the money. I don't care. I've been in private practice 20 years. I'm not going to get a job now. So a lot of them just say nope, forget it. Some will say, well, let's talk about it, and they do some due diligence. That drives a lot of physicians off too. The thing, private equity is getting better. In the old days, it used to be just like IBM taking over a company. They'd come in and say, okay, we want to see all your income statements for the
Hmm.
last 5 years. We want to see your accounts receivable. We want to see all your liabilities. We want to see your pension plan. A lot of physicians will just say, I don't have 27 staff sitting around just waiting to do this due diligence. I can't do it. Forget it. And in the old days, a lot of practices just the deal fell through there. Now private equity is getting a little more sophisticated, and they'll send somebody in to go
Hmm.
through the books and look at what they need. But due diligence is the first thing. I've represented practices where reimbursement dropped. The partners didn't want to lose money, so they took a line of credit out basically to pay themselves. And those are the kind of things that private equity will say that's fine, but we're not taking that line of credit over. If we sell, you guys are responsible for the line of credit.
Now, from the physician standpoint, if they're considering a private equity buyout, tell us about some of the issues and points that they really need to ask themselves to seriously consider this.
Well, I think one of the biggest things is if you are joining a private practice, you have to have a contingency for that. You have to say, hey, if we're going to sell, I want to be treated as a partner. Because a lot of times a private practice, they'll bring you in and they'll say, look, we're not going to pay great, but you get the golden ring of partnership. You pay your dues, and in 3 years we'll make you a partner. And the partners are doing pretty well. Our employed physicians are making less than they could at a hospital. But the good news is in 3 years you'll really be doing well. And what happens to the physician coming in sometimes is then the practice sells to private equity. So you've accepted kind of below median income for 2 or 3 years, expecting to get the brass ring, and it's pulled out from under you. So that's kind of a contingency that I always try to put in with varying degrees of success. I mean, if I've had people say, yeah, sure, no problem. People that say there's no way I'm ever going to sell to private equity. So it's kind of the same as, if I insisted on it and we were doing a deal that you pay me $10,000 if you ever shoot my dog, you probably wouldn't make that a big negotiation point. You weren't planning on doing it. It's never going to happen in your mind. It seems important to me. We can put it in the contract. So those kind of deals usually go smoothly, but a lot of practices will fight back because they just don't. I want flexibility. I own it right now. I'm not thinking about private equity. Somebody came in and offered me, hundreds of thousands of dollars. I'm not going to tell you that I've built this practice. I've been practicing 20 years,
Mhm.
25 years. I'm not going to tell you, but you can just ride my coattails,
Mhm.
and come in and get that bonanza too. So sometimes it's a tough negotiation, but I think it's important to bring it up and try and get, some kind of resolution for the new physician.
So, for a new physician joining a practice, introducing some type of private equity clause right up front, that's something that you would advise.
Yeah, yeah, I do because as I said, sometimes it's no big deal. If the practice says there is no way I would ever consider selling to private equity, they're probably not going to fight that clause real hard. But as I said, I talked about the example of $10,000 if you shoot my dog, but right now you may love your new car, but I don't know that if we put it into the agreement that you pay me a lot of money if you choose to buy a new car, you're going to say, well, I'm happy with the way things are, but I'm not really willing to, limit my options in the future. And I do get that quite a bit.
So, if a private practice is considering selling to private equity, what other parts of the physician contract is most commonly affected?
Well, the thing is most important for the new physicians coming in who are not partners. The people that are owners, a lot of times their contract doesn't massively change. Sometimes it's a little less, actually, sometimes, not always, it's a little less eat what you treat, and it's more here's your salary
Hmm.
and you have a bonus. Although practices that are doing eat what you treat, a lot of times will continue that with private equity. So there's not that many differences, and sometimes the physicians like it. I mean, you didn't go to med school so that, when Susie, the receptionist, gets sick, you've got to figure out, do
Hmm.
we go to a staffing agency or who's going to answer the phones? Sometimes people are relieved that we go to private equity and they hire all the employees, they deal with the pregnancies, they deal with the poor performing
Hmm.
employees. As I said, there's some advantages to doing private equity. So sometimes, as I said, physicians are not all that displeased working for private equity.
But for the new physicians in a practice being bought by private equity, do their compensation structures typically change a lot?
No, a lot of times they don't. I mean, sometimes it goes up, and a lot of times there'll be a decent signing bonus. When you sell to private equity, most of the times the way that the purchase price is determined is some multiple of revenue. So if you think about it, if there's four physicians and you're number four, but you're employed, you're probably producing close to 25% of the revenue. So both the practice and the new private equity are going to be very interested in keeping you. They're not going to come in and say, you got a low ball deal now because you're going to be a partner. Well, you're not going to be a partner, and we're going to keep paying you low ball. Most people would say, well, why should I stay? The hospital will pay me more. I can snap my fingers and get a better deal. So sometimes you can get a very, very lucrative buy-in to that. I talked about in the article a situation where somebody was promised in 1 year they'd be a private equity and they would get hundreds of thousands of dollars basically given to them so that they could buy into the bigger fish. Only the bigger fish got swallowed before that year was up, and that physician was offered something like $50,000, whereas the partners were each getting hundreds of
Mm.
thousands of dollars. And so there wasn't a particularly happy negotiation, but we were able to, increase the signing bonus, get him a retention bonus, and get him a little more money. He still didn't do nearly as well as if that practice had been sold, the day after he had become a partner.
How about parts of the contract outside of compensation, like benefits, for instance? Do they typically change?
To the extent they do, it's not uncommon that they're better because, private practices tend to run a tight ship. And a lot of times the private equity will come in and say, we've got this massive, deal with the health insurance company, and you smaller copays and maybe even less monthly. So a lot of times the benefits are almost as good, in some cases better. And some cases like the retirement plan is better. And the other thing is a lot of private equity will allow you to buy into the private equity concern. And it's not uncommon that they will actually give you money to do it. So in 2 years or 3 years, we're going to give you enough money to buy an equal share of the physician's part of private equity. So the whole idea of private equity is we buy cheap, we hopefully sell for 3 times in 3 years. If you are an equity owner in the private equity, you benefit from that too.
So it sounds like that from a compensation standpoint, in many cases, private equity would benefit, especially the older partners. And like you said, in some cases, benefits could and retirement plans could be even better as well. So, what are some of the reasons why physicians are so dissatisfied with the private equity movement that you see? Why are so many physicians unhappy with this?
Well, it depends on the company. I mean, if you think about there's companies like Patagonia, that are out there to make money, but they also have a strong, public bent, and they support good causes and they care about their people. Well, the same with private equity. There's not a Patagonia equivalent, but in private equity, there are some that say, look, these physicians are the people that are making us the money. we're going to make a lot of money from this deal, but it's important that our physicians do well too. Some, I think, really do believe in quality care. I mean, I'm not sure that that trumps profit, but I think for some it truly is more than just, a buzzword. I think they really do want to provide good care. So as I said, they are going to be more likely to put the money into a capital investment that maybe a private practice would say, we could really serve our patients better if we had one of these, but they're just too expensive. And it's, it might break even, might get a tiny bit of money, but we don't want to, borrow a ton of money to get it. So in those cases, private equity will come in and say, hey, we know we can at least get our money back. We think, with marketing, we think if you're the only guys in town with this gizmo, that we'll do very well with it. So we're happy to put the money up, for that gizmo.
Now, there are some studies that show that private equity backed practices have worse patient outcomes and worse quality metrics compared to practices that aren't owned by private equity. Is there anything that could be negotiated in a contract that protects and maintains patient care?
Yeah, a lot of times I will try to get something in that says, number one, I'll keep the same schedule I have. So you don't set my schedule. And I might be working 60 hours a week now, but we agree that I'm going to keep basically the same schedule. We're going to agree basically the same call coverage. I've had agreements where we got down to the nitty gritty of new patients will be a 1 hour consultation, and if you start doing that, what's important to the practice? Well, we think we're different. So what was involved in a sale of one recently where we think we're really different because we have an hour, or it might have been 90 minutes, new patient consultations. And so that went into the contract. In your employment agreement, it says new patient consults will be no less than, this minutes. So you can do things that right now, when it's all physicians doing the calls, maybe you don't think about it. Obviously, we're going to treat patients as well as we can. And obviously, for a new patient, we need this much time. Sometimes it's not so obvious to private equity. It says, well, if you can get 3 patients in that time, we make more money. So, we think a new patient 30, 20 minutes is fine. And so you just have to get that in the employment agreement or the purchase agreement. It's usually the employment agreement.
So you mentioned that private equity is expanding the scope of practices that they're looking to buy. Tell us what kind of trends you see in the foreseeable future when it comes to private equity involvement in healthcare.
I think it's just going to continue. There's a lot of money in healthcare. So I think you're going to see them getting deeper into some specialties like dermatology now. It's in my experience, I don't see too many private practice dermatologies anymore. They're almost all been bought out. I think it's going to expand into other sections. And I think eventually they're going to start taking over some of the hospitals too. The hospital chains and their physician practice groups sometimes are not as robust as you would think. I think that's going to be more of an integrated model where we're going to do an integrated delivery system and we're going to capture those primary care physicians because we want to make sure they're putting patients in our beds. So I just think it's going to keep expanding. I don't see it cutting off in the near future.
So, in that context and with that in mind, what are some things physicians can do to maintain our independence, assuming what you say is true, that private equity is only going to expand, eventually buy hospitals? And I know in my local area, there's been a disastrous partnership between a private equity and a hospital system. And is there anything physicians can do to protect themselves in that environment?
You can try to. I mean, I think the biggest thing you do is what you do naturally. You do the best care for your patients. So the concern would be the dermatology practice won't sell. So private equity is going to come in with a new dermatology practice. I think that is a threat that they can make. And to the extent they are controlling primary care physicians, they may have some success with that. But the bottom line is if yours is the go-to practice and everybody knows that you treat patients well and you've got good outcomes, I think you'll do better. It's going to depend a lot too on the referral situation. If they own the referral sources, just like a hospital is going to say, our primary care physicians will refer. to our specialists. And so that's going to be an issue. You've got to be aware of it. But I think doing what you're doing and doing what you do naturally is do the best care you can for your patients. I think that's ultimately going to be your best protection.
And when it comes to legal representation and counsel, is there any specific type of attorney a private practice should rely on to go through this negotiation path?
A lot of times you'll have two. You'll have a healthcare attorney who really understands, the reimbursement issues and stuff, and then an M&A, mergers and acquisitions attorney that comes in and does more of the, business aspects and reviewing the bylaws and stuff. But I think if you had to choose, I'd go with a healthcare attorney over an M&A attorney.
We're talking to Dennis Hursh. He's a healthcare attorney. Today's Kevin MD article is Private Practice Employment Agreements. What happens if private equity swoops in? Dennis, as always, let's end with some take home messages that you want to leave with the Kevin MD audience.
Yeah, I think don't dread private equity too much. Some of them are really not bad to work there. But I think the thing that you do need to think about is if you're joining a private practice, even if you're joining a private equity practice, because they can be bought, you really have to protect yourself and make sure that you don't accept below median income with the idea that eventually you're going to be a partner and make it back. There has to be some protection if private equity swoops in and buys the practice. You have to be protected somehow.
Dennis, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Sure, it's my pleasure.